Hi, I'm Dr. Barry Gillespie. I have my practice in the King of Prussia Medical Center in King of Prussia, Pennsylvania, the United States of America. And today we're going to talk about some meaningful clinical experiences, and I'll tell a few stories. And it'll explain the power and the breadth of CFT. In my career, I've written 3 books, and my first book was in 1999, Healing Your Child. And then I wrote the seminar workbook and also the brain score book in 2010. And what I found out was, because we were creating and discovering so many new things, these books became outdated pretty quickly after a few years. And I'd gone through all the publishing process, and it was a lot of work and a lot of time, and I thought there had to be a better way. So what I strongly felt was that instead of actually writing a 4th book, my 4th book would be on the internet and would be on my website. So if you go to my homepage, GillespieApproach.com, and go to the top line, and you'll see a little box there that says Baby Discoveries, and click on that. You're going to see hundreds of posts there where we actually made the discoveries and things I found in babies, and I have a few guest people that also made discoveries. So we have about 250 posts right now, but they're just going to increase over time. And that is my new book. And it's kind of great in a way because I don't have to go through the whole publishing routine. And I think it's great for the user because anyone in the world who has a computer and internet can get on there and read it for free. Free being the key word. We have Google Translates there where it could be translated into 60 languages. So we feel that our newborn work, our baby work, is a global situation. So in order to get that out to the world, we have to have it available for everyone, and have it in book form with so many languages in the world just wasn't working for me. So we're happy to put it on the internet for free. So again, you would go to Baby Discoveries. It's right on the top level of the home page. The first story took place in Montana in the summer, August of 2012. And we were giving a seminar out there in Missoula, and we gave our 3-day seminar, and after that we had a 3-day baby day training. And as it goes, that first baby day, I was at a table and I had 4 students with me, 4 students who had never touched an infant toddler, and they were there to learn. And we had a really nice mom who brought her 5-month-old, and his name is Corbin, to the class to be worked on. And you can read Corbin's story on the newsletter section of my website. It's the winter 2013 segment. And if you click on Corbin's story, you can read the whole story. But basically, he had a very distorted head, a very twisted head. His head wasn't symmetrical at all. And his mother said he had a very tight, twisted neck, and he couldn't roll over at all, and he had trouble crawling, and he had leg problems, and he just had trouble moving around. And she had spoken to one of her massage therapy friends in Montana, and the friend recommended, why don't you go to the seminar, and you could have free treatment with Dr. Gillespie and his staff. And Mother was thinking about it, and she really wanted to do that because someone had told her that her son would probably need a helmet to put over his head to straighten his head out. So the mother didn't want to do the helmet. So she said, let's give this therapy a try. And she was expecting that maybe over a series of months that the head might start to realign a little bit. And that was basically her expectation. So we have Corbin on the table, and I had 2 students, 2 brand new students, first baby, and they were working on. I had one doing CFT in the lower body, another one doing CFT in the upper body, and I'm just holding Corbin's head. And I wasn't doing any cranial work. I wasn't really doing anything. I was just holding his head, supporting it, so he wouldn't flop around. And as I'm holding his head, I'm talking to Mom and make sure Mom's okay. And the backstory was that Corbin had never cried. He only cried once or twice in his life. And so when we started the therapy, he started getting angst and he started crying, and I looked at Mom, and we had some students giving her a hug and trying to comfort her. But while I was feeling his head, I could feel the bones all shift as the two students were doing therapy in the fascial web. The cranial structures were all moving. And I was like, wow, what's this? This is different. And when the session stopped, we had to wait a little while for Corbin to stop crying, and Mom hugged him a little bit. I had felt that the bones had shifted in his skull, but I didn't say anything. So we do it again. We do the same technique again, and I got the two other new students. Somebody do the lower body, somebody do the upper body. I'll hold the head again like I'm just doing nothing. I'm supporting the head. And we get into that session, and again the cranial bones are all shifting, and it looks like they're more symmetrical. And when we were done, I was feeling his head, and it looked like a different head. It looked very much more symmetrical, and this was within 10 minutes. Now in the past, I've seen heads change shape, but I usually see the child every week, every other week, and you might see that over a period of a month or two. But I never see anything like this in 10 minutes. So we really didn't say anything, and the mother, Corbin was crying, and mother gave him a hug, and she left, and we got an email or a text a little bit later that day. She had taken him out to the car, and she looked at his head, and she said, gee, his head looks different. And she felt his head, and she said his head is more symmetrical. She said, that can't be, because a head is a solid structure. It just doesn't move like that. It just can't do that. But she kept feeling it, and she was out in her car for 15 minutes, just looking at him and just trying to figure out what the heck happened inside. And his head did change positions. So she drove over to her mother's house. She walks in. Her mother says, the first thing the mother said, what happened to his head? His head looks different. So the mother puts her hands on his head, and it did change. And the mother emailed us, and she came in the next day, and the day after that. Corbin got more therapy. Basically, the bottom line, his stiff neck freed up so he could twist his head, and he rolled over that day, and he started crawling, and he started moving. And basically he was tight. His whole craniosacrofacial system was tight, and we loosened it. We helped to loosen it up over a period of 3 sessions over the morning classes. So she was thrilled, and her only complaint was he was too wiggly now. Now she had to chase him all over the place because he didn't move much before, and now he was really moving. So it was a very exciting thing, and it was very educational. It was a real eye-opener for me. It just told me how much the cranial structures are attached to this craniosacrofacial system. And even though I didn't do any cranial work, just when this whole system started to get into play in therapy, the bones started to move, the brain started to move, everything started to move. I was taught with the chiropractors doing cranial in the 70s. I was taught with the cranial osteopaths in the 70s, early 80s, that we had to do cranial, and I found out that you really don't have to do that in at least some cases. I was just amazed that I was in the same mindset that the head is kind of a solid structure, but even at a 5-month-old, everything started to move and shift, and it was just a real eye-opener for me and for all the students. The second story is about a young baby who had charge. And if you're not familiar with charge, please go to the home page and scroll down to the first video, and you'll see the baby with charge. And the mother did a beautiful video about her child. I'm just going to take a little section of that video. The story is also up in the article section, a baby story. You'll see charge there. The mother wrote out the whole story of what happened. It's a beautiful story, but again, I'm just going to take a little section of it. So the mother had brought the baby to baby day out in Lancaster, where we saw our hundreds and hundreds of babies, and this baby was part of our baby day. And I remember it was on the 5th visit, and I'm feeling for strain in the right eye. And the baby had strain in her right eye, and I could trace it. It was pulling all the way down into her right kidney. And there was tremendous amount of strain in her right kidney. And I just started getting into it, and this whole right lower quadrant just seized up, and it was just so tight. Again, we're talking about an infant, and that infant is crying. I mean, and mom is riding the bull, and we're all there just being present, but there's just an ungodly strain going down into that kidney. And I've seen thousands of children before, and have never felt strain like this going into this organ. And we took a break from that section, and we did a little bit more that morning, and again, strain went down to the right kidney, and it was fierce. It wasn't as much as that first time. And then we did another time, a third time, we went down from the eye, down into the kidney, and it was pulling in the kidney, but it was a little more normal here, but it was still pulling really hard. And I remember going home after that session, and usually I go home very excited about all the discoveries we make at baby day, with reflux and colic and stridor and all these different conditions. And I was a little upset. I was questioning God, how could a baby have so much strain in their body? It just seemed surreal. It was unreal. And I went up before the mother left, I went up to her and I said, gee, I've worked on a lot of kids over the years, but I've never seen strain like this going into the right kidney. You really need to go to a doctor to have that kidney checked out. There's something going on in that kidney. So what she told me the backstory. The backstory was the week before, she had taken the baby with her husband to Children's Hospital of Philadelphia. For those of you outside of Philadelphia, Children's Hospital of Philadelphia is ranked the #1 pediatric hospital in America. It's usually one every year, or if it's one or two, but they're like the top doctors in America are there. And a urologist had a specialist look at this child. And they did a lot of testing, ultrasounds and whatever testing they did. And the urologist came out and said, your child has hydronephrosis. And the right kidney is 3 times as large as normal. It's 3 times as big as the left kidney. And the ureters, the tubes from the kidneys down into the bladder, they're all twisted up like spaghetti. The ureters should run a straight line right from the kidneys right down into the bladder. But in your child, everything is all mixed up and it's tight and it's all twisted. And he said, your baby's young right now. We need to wait a few months. Your baby's probably going to need surgery. But again, too young. Come back in a few months. Come back a little bit later. We'll do all the testing again, and we'll see what happens. So I didn't know this story. So the mother says, I can't believe I went to probably the best hospital in America. They did all this tests, and they said there's a problem here. And now I come to you folks, 3 massage therapists, in an Amish basement with no electricity, no testing, and you're telling me there's a problem in the right kidney. So at that moment she said, I was sold before about this work. I'm totally sold right now. So she was good she rode the bull as this child really worked through a lot of the strain. And on the next visit, the 6th visit, it was less in there. And the 7th visit, it kind of mitigated. It took 3 visits for this kidney strain to go away. But it was fierce. So we'd finished therapy. I think it was about 12 or 13 visits. And about a month later, the parents went down to the same kidney specialist at CHOP. And they do all the testing, the ultrasound, whatever testing they do, and they're checking for renal reflux. And the surgeon comes out, and he's kind of dumbfounded. He said, we've looked at all the tests, and everything's normal. We can't believe what we saw on the ultrasound and on all this testing. The right kidney, which is 3 times as large, is now the same size as the left. And the ureters that were all twisted up like spaghetti are all, they're straight now. They just go from the kidneys down into the bladder, just like normally. And he couldn't understand it. And your child doesn't need surgery. You know, you're done. You don't need me anymore. And the parents were there dumbfounded. And I think the mother called me, emailed. She very, very quickly, she had to tell me the story. And I just sat there and just, on so many levels, was just so grateful. It was kind of unbelievable, because we were out there working on 500 babies, and we had no testing. We didn't have electricity. We didn't even have lights. We were in Amish basements. They don't have electricity. We had a little window where the light came in. We had a table. That's what we had. And we were just following the body. But what I learned was that the fascia went into the organ. The fascia went into the kidney. It just didn't go around the kidney. It went into every cell of the kidney and made that whole organ tight. And when it got tight, it must have gotten much larger to function. And when that tightness in the organ went away, the kidney just went back to normal. And all that unwinding we did in the pelvis and then in the belly, and this whole area in the lower back and the kidney, apparently what that was doing was that it was working out the strain around the ureters so that they become less spaghetti-like, they become more normal. And we were very excited. This therapy, we were especially excited because we had really no collaboration. All we know was that if you had colic, the colic got better, or if you had reflux, or if you had pyloric stenosis, whatever disease we're looking at, we got better, but we never had confirmation from a medical model like this. The parents went to literally the best hospital in America. Doctor said there was a big problem. Now there's no problem. So we were excited. And on another level, we were very grateful this child didn't have to have surgery. You know, God knows what would have happened in surgery. The kidney's 3 times as large, and what's going to happen and what are they going to do. So we were excited about the power of the work, but we were also excited about, we felt that we possibly saved this child from a pretty extensive surgery.